Hi, my name's Kirsty Thomson. I work as a physiotherapist in the Musculoskeletal Interface Service, and I want to share with you today my recent experience of carrying out a CAT, which stands for Critically Appraised Topics on Greater Trochanteric Pain Syndrome. So I work in a busy interface service, and I noticed that patients being seen for this condition received different treatment depending on which clinician they saw, with treatment options being physiotherapy, injection therapy, or education and wait-and-see approach. Greater trochanteric pain syndrome is a great example of how our clinical knowledge has progressed in recent years. It was once believed that this condition was due to inflammation of the bursa, but we now know that the bursa has an insignificant role and there's very little inflammation, and that the primary cause is that of tendinopathy. We know that injections for tendinopathies may delay healing and are associated with greater reoccurrence and poorer long-term outcomes. We also know that tendinopathies respond well to a load modification tendon-loaded program, as demonstrated in Achilles and patella tendinopathy. So I wanted to explore what the evidence was for the management of greater trochanteric pain syndrome and whether load modification did better than injection therapy. So I took this question to our local CAT group, and together we developed a PICO, which stands for Population, Intervention, Comparison and Outcome, and together developed keyword searches for our librarian to carry out a literature search for us. A number of studies were identified, but a good randomised controlled trial by Mellor et al. In 2018, which compared a steroid injection versus load modification program versus wait-and-see approach, found that a load modification program delivered by a physiotherapist did better at 8 and 52 weeks. Therefore, patients with greater trochanteric pain syndrome should receive a tendon load modification program by a physiotherapist as a first line of treatment for the management of this condition. It's important that we share this information with our patients, as they need to be informed when making decisions on their further treatment. It's also important that we share this information with our colleagues so that we are all using up-to-date evidence to inform our practice. This information has been used to inform our clinical pathways, and I've also been asked to share my experience with other CAT groups to demonstrate how, working as a clinician, it's important that we ask clinical questions, and with the support of your CAT group you can answer these questions, and this may lead to a change in practice. Thank you for listening.